Chris Stevenson here with another 5 in 5. That's 5 questions in 5 minutes. I'm here at the Complete Performance Center with Dr. Chris Alvarez, one of the area's top chiropractors. So we're going to ask him some questions about chiropractic. What is chiropractic?
Chiropractic is the balance between structure, motion, and function. And we believe that the body heals itself. So if we balance the structure, motion, and function, we allow the body to heal itself. Simple as that.
Okay, perfect. Okay, question 2. When does one go see a chiropractor?
Oh, it's a really good question. Most people come and see a chiropractor when everything else fails. And what we find is if we get to a patient before there's a lot of chronic history to it, then they'll basically respond a lot better. So my patients usually come and see me usually after about 3 or 4 days if they're not responding to what we consider ice, elevation, compression, and rest.
Okay, so basically the sooner the better. Some of those will go wait a couple days.
Come and see us.
Call Dr. Chris.
Absolutely.
Okay, got it.
Yeah.
Great. Question number 3. When you think of chiropractic, you think my lower back hurts. Obviously there's more to it than that. What else does chiropractic entail?
Well, most people think of chiropractic as low back, like you said, but we're doctors of muscle, bone, and nerves. So we work a lot with shoulders, we work a lot with knees, we work a lot with ankles. And the majority of my practice is shoulders, knees, and ankles, and then spine.
Okay, great. Okay, question 4, and this comes off the last answer you had. You mentioned that a lot of your patients aren't lower back, but they're shoulders, knees.
Right.
So you think of chiropractic, they're chiropractors adjusting your spine, so how would a chiropractor work on a shoulder, a knee, or other body part?
Well, my philosophy is that we have to balance the structure. So when it comes to a shoulder, we need to look at the whole shoulder. We need to look at the movement of the shoulder. We need to look at the muscles of the shoulder. We need to look at the balance of the muscles. So is the front stronger than the back? Or is it vice versa? So looking at the structures, looking at the motion, we kind of see how the function works. And if the function isn't working, then we always look at the structure, and we always look at how everything moves. So we evaluate the shoulder, we identify what muscles are maybe not working very well, what muscles are compensating, and then based on that, we put a plan together to kind of fix that.
Okay, awesome. And finally, question 5. With training, there's good trainers, there's bad trainers. With any profession, there's good and there's bad. When you're looking for a chiropractor, how do you know you're choosing a good one? What distinguishes the good from the bad?
Well, like in any profession, you got to have somebody who's thorough, number 1. Number 2, in our line of work, I think caring has a lot to do with it. You need to have a relationship with that patient, and you need to feel like they're the right person for the job. And in our profession, there's a lot of people that are great chiropractors out there. However, we work with a lot of athletes, and I've had the pleasure of working in a lot of different sporting events, and so it's nice to have that kind of experience. But with anything, you can say that you have a shoulder problem, and you can snap a diagnosis on it and say you have rotator cuff tendonitis, but the reality is that everybody has different problems, everybody has different stresses in their lives, everybody has different mechanisms of injury. We have tight muscles, we have weak muscles, and I think finding a doctor that can tailor, customize a plan, and follow through with that plan with exercise as well as stretching is really, really important.
All right, so overall, it's just something, there is no cookie-cutter approach. So you really want that person who you bond with, who cares,
Right.
who has that super customized program for you.
Ideally, yes. That's what we do.
Makes sense to me.
Yeah.
Dr. Chris, thank you very much.
Absolutely.
Again, we're here at the Complete Performance Center. Hope you find this information valuable. I know I did, and until the next 5 in 5, remember, fitness is a choice.